name is Kevin Huynh, and here are my colleagues Liggett, Amy Newberry, and Michael Woodall. And we are all students here of physical therapy at Augusta University. So today we're going to be talking about social workers and their role in the healthcare practice. So really quickly, I want to give a broad overview and some statistics of social workers. And this is according to the Bureau of Labor Statistics, but the number of jobs as of 2014 are about 650,000. The job outlook from 2014 to 24 is expected to have roughly a 12% increase. The average median pay of a social worker, according to the year 2015, is roughly $45,000. So really quick, I want to talk about the educational background and the professional training of a social worker. And there are essentially three types that you can have, which is a bachelor's of social work, a master's of social work, and a doctorate of social work. And I'm going to touch base a little bit on each one of them. So first off, there's the Bachelor of Social Work. And for someone with a bachelor's in social work, you cannot be licensed. And that essentially means that you have to practice under supervision of an actual social worker. However, you can be a direct services social worker. And to put it in a nutshell, we're going to cover it more later on, but to put it in a nutshell, a social worker is essentially going to connect people with the services that they need. The difference between a direct services social worker and, let's say, for example, a clinical social worker is that they're not allowed to work with people with serious illnesses or psychiatric conditions. That would apply more to a clinical social worker. The other benefit of having a bachelor's in social work is that you have the option to enter a master's program as what they say an advanced status. Usually a master's program will require you to stay there for 2 years to finish the program, but entering in as a bachelor of social work, you can finish that within 1 year. Next up in the hierarchy of social work, you have a master's in social work. And this is essentially required for anyone that wants to be licensed as a master social worker or a licensed clinical social worker. Also, a master's in social work is required for anyone who wants to participate in work that's beyond entry level. And like I said before, this takes 2 years to complete. Unless they have a bachelor's, then they can essentially be an advanced status. A majority of people who do social work and is essentially required is to have a master's in social work. There's also, if you want an independent clinical licensing, it also requires a master's degree plus post-master's practice under the supervision of someone else for 3 years. And last of all, you have the doctorate of social work, and this is going to be the highest of the three. The biggest benefit for social work, or a doctorate in social work, is that for people who want to advance in education or research, or if they want to participate in higher level education. But other than that, if someone doesn't plan to go further along those kinds of roads, there really is no true benefit to having a doctorate in social work except for maybe higher pay. So next up, to talk about licensing, we're going to have Amy Newberry.
So there are two main types of licensure for social workers. The first one is a licensed master social worker, an LMSW, and the other one is a licensed clinical social worker, LCSW. And similarly to what Kevin said, an LMSW works more with protecting children and families in need, whereas a licensed clinical social worker deals more with diagnosing and treating mental issues and behavioral and other emotional issues. But something they have in common is the process, besides for a clinical social worker, the 3 years of clinical experience. So an LMSW, they will need a master's in social work from an accredited program, as well as pass the board exam within 1 year of graduating, and they'll also need to apply for licensure to the state board. And that involves an application, 2 references, official transcripts, and a background check as well. An LCSW is similar to the normal route of being licensed, but instead the one difference is that they will need 3 years or 3,000 hours worth of clinical experience that is directly supervised by another clinical social worker. It is also recommended that they have an LMSW prior to this. And another plus to getting a doctorate in social work is that instead of having 3 years of experience to be licensed, you just need 2 years. And next up we'll have Michael. He's going to talk about the duties, skills, and knowledge of a social worker.
Okay, so Emily Burdine is the social worker we interviewed for this project, and she really helped us narrow down and clarify some of the skills, knowledge, and responsibilities needed to be an effective social worker. So there's definitely many fields that a social worker can specialize in, but some may work in a clinical setting where they need to help people with mental and physical health issues, emotional problems, and behavioral needs. Some social workers can also work in more of a direct service basis where they will directly help people with life problems, abuse issues, and illness. And really the main focus is to assist people in overcoming their issues and ensure that their clients get the care that they need. Some of the more common responsibilities is to really be a good listener to the clients and provide or facilitate an unbiased solution to their issues or concerns. Some of the more common duties that social workers have to perform are a client interview, where they'll need to get a thorough understanding of their client's situation. They'll also need to practice obtaining thorough client history because they'll need to know effectively what's going on with that client, what they've been through, and how to progress them with their care. And they'll also need to have skills in connecting clients to further needed resources, such as healthcare services if they qualify. Some of the major skills are strong communication, active listening, being personable. They really just need to be able to build a rapport and build trust with their client to ensure that their client will get their best care that they need. Some of the knowledge that they'll need to possess is how to properly interact with the clients. And autonomy and self-determination is very important. And what I mean by that is the social workers themselves need to be able to make decisions and act without external influence. And it's really important to be able to have independent decision-making to help your client progress. And as Emily in our interview stated, she says social workers are sometimes referred to as mandatory reporters, where they must alert the proper authorities pertaining to client safety situations. And the knowledge and experience needed to know when to report a situation is very important as a social worker, because as sometimes their client's life or health could be at risk. As far as how social workers and PTs interact, our particular social worker wasn't very familiar, but she was able to steer us in the right direction. Social workers often lead the service team on their client's behalf, where they will just work with other healthcare providers or counselors to ensure that their patient is getting the care that they need. And social workers that are in a state public health unit can refer patients that have eligible healthcare conditions to further care, such as a physical therapist. And in some situations where a social worker could be part of a hospital staff, they would be involved in the discharge plan for their patient. And this is something where the PTs and social workers would interact, because the PT would be consulted and brought in to provide the specialized care that they can give and to facilitate the person's ability to function independently. And another aspect of being a social worker is ensuring that their client attends all appointments. And that could be helping the client with transportation to get there, or if they're not able to leave, working with the PT to possibly set up a home healthcare system. And so next up, we're going to have Hayden, and he's going to talk about some of the current issues that social workers are currently facing.
So there are a few major issues that social workers are facing nowadays. One of which that Emily enlightened us on is being undervalued. Social workers, due to their expansive scope, are often overworked, many hours, and underpaid. Because of this, a lot drop out of the career. Another one is social workers deal often with a lot of depressing situations. They see a lot of pain in families, a lot of hurt and psychiatric illnesses, and this can have a toll on the social worker who really cares about giving their best and making sure that their patients are being watched out for and cared for. And because of this, it's hard to kind of maintain a work-personal life balance, and a lot of times they lose vigor and staying vitalized for their career. And so this can lead to dropout and quitting their work. And lastly, social workers and direct access. So direct access is a term that refers to the ability of a patient to self-refer to a healthcare provider for evaluation and treatment. Usually this term is for physical therapists in particular. Since direct access applies to the provision of healthcare, social workers aren't really under this net. It doesn't really apply to them, especially since they are employed by school systems and government agencies. So what usually happens is many medical social workers are called in rather than people going to them to help provide services such as referral management, discharge plans, and patient education. That is it.